Second white coat. Subscribe and like. Let's learn medicine together.
All right, today we're jumping into what is basically a high-stakes medical detective story. It's a case where one tiny clue, a really subtle clue in the eye, can tell you everything about a life or death crisis that's happening inside the brain. This is a question that every ER doc has to figure out, and they have to do it fast. The answer? Well, it's all about this chain reaction, this cascade of events that kicks off with a bleed, and it ends with the brain literally running out of space. So let's follow the clues together and see where they lead.
Okay, so our story kicks off where so many of these stories do, in the emergency room. We have a 64-year-old man, and he comes in because he's in a world of hurt. He's got this sudden, really severe headache. And here's the thing. There was no fall, no car accident, nothing. Just this intense, out-of-the-blue pain. And when you look at his medical history, a couple of things really jump out. First, he's got long-standing hypertension, high blood pressure. We all know that can really weaken blood vessels over the years. On top of that, he has metastatic lung cancer. You put those two things together, and sadly, the risk for a spontaneous bleed inside the brain just goes way, way up.
So they get him to a CT scanner, and yep, there it is. The scan confirms exactly what they were worried about, a small hemorrhage, a bleed, right there in his left temporal lobe. Now, at this point, you might be thinking, okay, this is serious, but it seems manageable. But things are about to take a very sharp, very dramatic turn. The next 24 hours, they turn into an absolute race against the clock. The patient's condition? It doesn't get better. It doesn't even stay the same. It starts to spiral downward, and it's happening fast. And this, right here, is where the real mystery begins. So look at this timeline. It's a shockingly rapid decline. The patient goes from being awake and alert to becoming less and less conscious, what doctors call obtunded. Then, boom, he starts having these full-blown seizures. And if you look at his vitals now, heart rate, blood pressure, breathing, they are all screaming that something is terribly wrong. We've officially entered critical territory. They rush him for another scan, and this one gives them a terrifying answer. The bleed isn't small anymore. It's gotten bigger, and it's now so big it's causing something called brain herniation. So what on earth does that actually mean? What is physically happening inside this poor guy's head? Okay, to really get what's going on, we need to take a quick detour into physics. Think about it. The skull is a hard, rigid box. It doesn't stretch. And we need to understand what happens when you start adding pressure inside a closed space like that. This is what we call intracranial pressure, or ICP for short. It's just the combined pressure from everything that's supposed to be in there. The brain tissue, the blood, the cerebral spinal fluid, all of it. And normally, it's this perfectly maintained, delicate balance. But our patient's growing hemorrhage, it's about to completely shatter that balance. That bleed is what doctors call a space-occupying lesion. It's a fancy term for something that's taking up space where there is literally no extra space to give. So as that pool of blood gets bigger and bigger, the pressure inside that bony skull just skyrockets. And that massive pressure increase sets off this terrifying chain reaction. Step 1, the bleed gets bigger. Step 2, the pressure inside the skull goes through the roof. Step 3, the brain has nowhere to go. So a specific part of the temporal lobe, called the uncus, starts to get squeezed and pushed downward. And then, the final, most dangerous step. It starts to crush the brainstem. The part of the brain that controls breathing, heart rate, all the stuff that keeps us alive. This whole event has a name. It's called transtentorial herniation, or Uncal Herniation. And let me be perfectly clear about this. This is one of the absolute worst neurological emergencies you can have. But even in the middle of this disaster, the body sends out a signal. One very specific, very powerful clue. And here's the kicker. You won't find this clue on a CT scan. You find it by doing one simple thing, looking very carefully into the patient's eyes. This is one of those moments where the old-school physical exam can literally change everything. So how does this work? Well, here's the crucial connection. As that part of the brain, the uncus, is getting shoved downward, it physically smashes up against a super important nerve right next to it. It's called the oculomotor nerve, or cranial nerve number 3. And its job includes carrying signals that tell the pupil to constrict, to get smaller. Now, the most important part of this whole story is that those specific nerve fibers, the ones for pupil constriction, they run right along the outside of the nerve.
So when pressure hits, they are the very first thing to get crushed.
So this creates like a tug of war for control of the pupil. You've got the parasympathetic signal that's screaming constrict, but that signal is now being blocked. It's cut off. Meanwhile, you have the sympathetic signal that's yelling, dilate, and that one is getting through loud and clear. So, what happens? The sympathetic system is now running the show completely unopposed.
This phrase just sums it up perfectly. When parasympathetic input is lost, sympathetic tone becomes unopposed. It's like cutting the brake lines on a car. Without the brakes, the accelerator just takes over completely.
And the result of all this is the single most important physical sign in this entire story. You look at the patient's eyes, and you see one pupil that is stuck. It's fixed, and it's wide open, completely dilated. And it's on the exact same side as the brain bleed. The eye is literally pointing to the problem.
Okay, so remember those crazy vital signs we talked about, the ones that were going haywire? Well, let's circle back to those because they're not random at all. They're another desperate last-ditch signal, and this one is coming directly from the brainstem itself. What's happening is that the patient's vitals are falling into this classic pattern, a pattern so well known it has a name, the Cushing's triad. And this isn't just a sign that things are failing. It's actually the brainstem's final, bizarre, last-ditch effort to save itself from being crushed. So what are the three parts of this triad? Well, first, you get sky-high blood pressure, severe hypertension. Second, and this is the weird part, you get a super slow heart rate, what we call bradycardia. And third, you get this really strange, irregular breathing pattern. It can be chaotic and even include moments where the patient stops breathing entirely. When you see those three things together, you are looking at the body's final screaming alarm bell. It's a sign that the pressure inside the skull is at a critical level and that fatal brainstem compression is about to happen if something isn't done, like right now. Okay, let's wrap this up. We've gone through a lot, so let's boil it down. What's the high-yield takeaway here? What's the critical chain of events you absolutely have to remember from this case? Simple. The cause? An expanding hemorrhage in the temporal lobe. The mechanism? That bleed causes the uncus to herniate and crush the oculomotor nerve. The key sign? A fixed, dilated pupil on the same side. Why? Because you'd lost those parasympathetic signals. And the other big red flag to look for? The Cushing's triad. That combo of high blood pressure, slow heart rate, and messed up breathing. And that really brings us to the final point. This whole story isn't just a case study, right? It's a powerful lesson in the art of observation. It teaches us that when you're faced with a patient who is crashing, when every single second counts, sometimes the most important answer isn't on some fancy monitor or in a CT scanner. Sometimes it's staring right back at you in the telltale pupil. So I'll leave you with this question. In that kind of neurological emergency, what are you going to look for first?